Basically, it's called a sports injury, but not all of them play sports. In a day-to-day, normally walking and tripping down, falling also causes injuries, similar to sports.
Okay.
So the ligament injuries can happen either due to accidents, you walk, you have fall, trip, or fall from a bike, that causes ligament injuries, or while playing sports as well. So ligament injuries per se can happen due to any other reasons.
Okay. And is this age-related in the sense, are you seeing more of these condition in older people?
Ideally, these ones will be younger patients or middle-aged, between the age of 20s and 40s. Because the older you get, what happens is the bone becomes weaker. So if you have a fall or you break the bone easily rather than damaging the ligaments. But in the middle-age group, the bones are quite strong. So even if you have a fall, the bone doesn't break. Prior to that, the ligament. So what happens is if you have a fall or something, the ligament, whichever the weakest structure, fails first. And then the next one happens. So even in a younger patient, if you have a severe injury, then they can rupture the ligaments and break the bones.
But is this ligament
it's like a process. It doesn't happen.
Is the ligament so weak that it just goes off just because a youngster is walking?
It's not weak. It has got a certain strength. It will only bear. A normal walking person will not have an injury. A normal day-to-day activities will not cause you a ligament damage. Any untoward force or unexpected movement. So you're walking and all of a sudden you don't see something on the road which is probably a big cavity there or a dip there. And if you actually step, then you lose balance.
Right.
Then what happens? You stop, but your body goes forward. That will cause you ligament damage.
Right. So what is
you are not expecting something there. That's unexpected movements. Then the ligament will not. The sudden movement, because if you expect something, then your muscle contracts and it protects you.
Right.
That's how it works. If you know what is going to happen and we can protect yourself, prior to that you can protect and guard yourself. That is how it happens. If an accident, that's a different one. If someone comes and hits you, that's different. Sure, but before the fall. But if you can't predict the fall or what's going to happen, then you're basically not expecting something to happen. Then your body is not in control. Your muscles will not act. Then the ligament takes the force and then it gets ruptured.